Well, welcome again to the sections of cardiology. This is Dr. Jaitly. It's a pleasure to talk to you, and I appreciate your interest in keeping up with my video presentations. Here's the next one. I'm following the previous presentation of the heart failure, which we discussed what the definition is and what the causes are. This is a sequelae of the previous one, and that is, what does the heart failure result from? It results from failure to meet the needs of the body, and so the individual is unable to carry on with the day-to-day activities. Very important. What does it cause? It causes enlargement of the heart, chiefly the left ventricle, which starts to enlarge. Then this chamber, the left atrium, will enlarge, and then the brunt is felt on the right side of the heart. So as we know, the right side contains impure blood, left side contains pure blood. So by the time all the four chambers are enlarged, it's called congestive heart failure. That's another term called congestive heart failure. Now, normally when you say congestive heart failure, it also implies that there is fluid inside the lungs and around the heart. So that is also very important, because then the congestion begins within the lungs, and as a result, the person is markedly short of breath because of fluid. Because normally, remember, the lungs should only carry air and there is blood supply. That's about it. But now lungs are like air sacs or air balloons within the chest. Now, if they start carrying water in it or fluid in it, you can't breathe. So obviously you'll be short of breath. You'll be very decompensated for the same amount of activity that you were doing so easily. Now you'll have to take several breaths in order to complete that activity, and that's called shortness of breath. The heart rate tends to increase also, because that's another way of compensating, trying to see if you can meet up the needs of the demand of the body. So if the person is not able to meet the needs, and the ventricle is getting weaker and weaker, so it starts contracting more often. That means from 60 to 70 times a minute, that was the original pulse. Now it will start beating, say, 80, 90, 100 times a minute, or even 110 times a minute. So therefore the pulse is about 100, 110. And that increase in heart rate initially is a compensation marker, but later on it's a marker of decompensation. Weakening of the heart muscle, of course, that is the sine qua non, or the sign, the hallmark of the entire heart failure syndrome, if you will. So once the heart failure sets in, a portion of the muscle wall, say whether it be this muscle wall, whether it be this muscle wall, whether it be this muscle wall, or this wall, and they all are named, and these walls, we'll talk about the names and other details in subsequent presentations. But just remember, just be mindful that any weakness of any of these walls, or combination of these muscle walls, will result into heart muscle failure or heart failure. Obviously the brunt is next felt by the kidneys, because kidneys are not getting the pressure with which the heart was originally pumping and squeezing the blood to, because remember, heart is sending blood to the rest of the organs, right from brain to your toes and everything in between. So the kidneys, the liver, they will suffer because the circulation is poorer and poorer, and they're not able to meet the needs, and therefore the kidneys cannot flush, therefore the urine cannot flow. So all those things will start to happen, and as a result, the kidneys and the liver also suffer next, besides, of course, the heart and the lungs. And then the swelling all over the body and fluid retention begins, because now the body will start to swell under the skin, maybe mostly at the ankles initially. At the end of the day, somebody will say, look, I think my ankles are swollen now. Or during the day or early in the morning, there'll be a lot of puffiness on the face, especially under the eyelids. So all these are symptoms and signs of heart failure, and one should be very, very alertful or cognizant about it, and report to the doctor and discuss all these things when you have any of these symptoms presenting. Specifically, so the shortness of breath and early fatigue, for what normal activity would normally not cause any, and now recently you're starting to develop all these symptoms, those should be immediately brought to the doctor's attention. Okay? Hope you found this portion of heart failure segment also interesting, and let's keep discussing heart failure as we progress in the next level. Okay? We'll see you again. Thank you for your interest. Bye.